This is the final module in this series on sex worker health. And in this module, we'll be going through some case studies that are real-life case studies to see how providers do interact with sex workers in reality and how what we've learned in these modules can be applied to provide much more comprehensive, compassionate, and effective care for sex workers. And so we'll be going through two cases that are cases that happened in real life that sex workers experienced within healthcare. And we'll be going through using these real-life cases to apply the best practices that we talked about in the previous module and consider the position that sex workers are put in within healthcare when these best practices are not followed. The first case study we'll be going through is Paulo, and there's a content warning for this case study because we will be touching on themes of sexual violence and rape. So to begin the vignette, Paulo Costas is a 25-year-old man, is queer, is a person of color, and is marginally housed. Before presenting to healthcare services, Paulo is drugged and raped. When he became symptomatic, such as night sweats, weight loss, and frequent sickness, it resulted in him losing his job of 5 years, and he was not able to maintain a new job. He was not ready to get tested because he would have had to accept that he got raped, something that he felt was not supposed to happen to him. When Paulo was getting close to using all of his savings, he was given the opportunity by a close friend to do exotic dancing under the table. That night, he made a lot of money and was offered to do escorting for a rate that would allow him to pay his rent by that night. He continued to do sex work because it allowed him to maintain his lifestyle, and he kept his health by eating healthy and going to the gym. It was not until he got sick in a session with a client that he passed out, and his client, out of fear, took him to the hospital and outed him as a sex worker. Costas woke up to a HIV specialist who disclosed to him that he was HIV positive. And because of his unpredictable lifestyle, she or any other physician would not provide treatment unless he quit sex work. Mr. Costas left the hospital with no treatment, and he could not quit sex work because it was his main source of income. Mr. Costas felt that it was important to disclose his status now that he knew it, even though prior he would always wear a condom. It was not until one client used that against him and forced him to have multiple sessions with him for free, or he would report him to the police for intentionally pausing the client. Mr. Costas was afraid and did what the client wanted until one day he was done and did not care if the client got him locked up and informed the client that he had recorded their conversation, and if he were to get reported to the police, he would also report the client for soliciting sex and forcing him to have sex with him. A year after his HIV diagnosis, he was admitted into palliative care due to his frequent hospital visits and acquired an AIDS diagnosis due to his CD4 levels falling below 200. Not only was Mr. Costas's right to human dignity taken away when he got tested without his consent, he was made to believe that there was no physician in existence that would care for him if he continued to support himself through sex work. So in going through this case study and in hearing not all but some of the details of Paulo Costas's experience, how would a harm reduction approach change the care that he received? And using our earlier education modules, what would have been the best steps for healthcare providers to take at each part of this story? So briefly going through that case study, there are a lot of moments that jump out as instances in which healthcare providers could have acted differently and could have provided support for this patient in a way that didn't isolate him from healthcare and in a way that met his needs and provided him with support. So within this case, Mr. Costas was given an ultimatum regarding either receiving health care or continuing to work in the sex industry. And as we've discussed, a lot of patients will find themselves in a position where they have no income and no way of maintaining stability if they don't continue sex work. And so giving someone an ultimatum is an incredibly difficult choice, and forcing someone to quit their occupation is also not beneficial for someone's health, for someone's ability to take care of their health. Throughout this case, there were a lot of assumptions made about the nature of his work, his relationship to his work, and a lot of judgment regarding sex work. And there was also extreme isolation from care and from support, from connecting Mr. Costas with groups and communities that could have provided support in a very difficult time. And so if we are to consider how to approach this case and similar cases through a harm reduction perspective and think about what we've discussed in the earlier modules. We would begin with meeting the patient where he's at, with moving away from the idea of the ultimatum, either healthcare or sex work, and listening to the patient when they arrive and meeting them exactly where they're at, even if they're at a very difficult point in their life. And then moving forward in meeting the patient where they're at, providing healthcare without conditions, healthcare that's not conditional on other factors of their life that they can't necessarily control. A harm reduction perspective would understand the patient's priorities, would listen to the patient's priorities and carry out what's most important to the patient first. A harm reduction perspective would provide a patient with options and give him control of his healthcare decisions, and would provide comprehensive care and connect him to necessary providers and support services. And now we'll be moving on to the next case, but I suggest you take some more time to think through this case study and how you would use what we've already discussed to provide the best quality care that you could to Mr. Costas, or a patient that you come across who finds themselves in a similar situation or going through similar challenges. Because we went through this very quick and there are a lot more things to highlight, but we'll be moving on to the next case now. So the next case is a patient named Maria, who is a 32-year-old cisgender woman that presents to the emergency department after being assaulted. Maria is looking to have her wounds cleaned and sutured and have x-ray images taken, and during her intake interview mentions that she is a sex worker. After disclosing that she does sex work, no other questions are asked of her, and she is treated with open hostility while her injuries are being treated. Maria asks if she can also receive an STI test, but is not given a response. Her healthcare provider leaves the room for a long period of time without an explanation and returns with a police officer. The provider says that Maria is a sex trafficking victim and that she needs to file a report against her trafficker that assaulted her. This is not what happened to Maria. She was assaulted outside of her work and was not being trafficked. She was a consensual adult sex worker. Maria excused herself to go to the bathroom and left so that she did not have to file the report. She did not receive the x-rays or STI tests she was looking to get done and avoided healthcare facilities in the future for fear of interacting with law enforcement. Throughout this scenario, providers made assumptions about Maria. They simultaneously judged her for doing sex work while pitying her for being an assumed victim of sex trafficking. Not only did Maria not receive effective care, she also was forced to disclose her involvement in the sex industry to the police and was scared to return to any healthcare facility in the future. What would a harm reduction approach to this scenario look like, and how could emergency room employees have provided effective and compassionate care for Maria? And again, what we saw was judgment on the part of healthcare providers that caused Maria to receive worse quality care, assumptions about trafficking and trafficking versus consensual sex work. We saw involuntary involvement of law enforcement and lack of connection to support services and lack of following through with what the patient was originally there for. So thinking about applying a harm reduction framework to this case, we would again prioritize listening to the patient and meeting her where she's at, avoiding assumptions and avoiding judgment to allow for the clearest thinking and making clinical decisions and being able to listen clearly to what a patient needs and then meet those needs. And again, prioritizing the services that Maria requested, which was treatment of her injuries, which she received, but she did not receive the x-rays to see if she had any fractures, and she did not receive the STI test that she was looking for. And so these things would be prioritized in a harm reduction perspective. And connecting Maria to support services would have been big. And finally, not involving law enforcement, because when the police were brought in, that was what caused Maria to be afraid to continue any kind of care and to go back to healthcare facilities in the future. And for this case as well, I'd suggest that you sit down and think through it more, given the education that we've gone through in the first module and the second module, and think about how you would best apply what you now know to these scenarios that happened in real life and very much can be avoided in the future. And knowing what we've discussed in these programs, you can now take this information and provide high quality care, provide comprehensive care, thoughtful and compassionate care to patients that you come across who work in the sex industry. You've reached the end of this case study module. Thank you so much for participating in this presentation. You can now continue to the self-assessment, and if you have additional questions, concerns, or are looking for more information, feel free to contact any of the contacts listed below or look to some of the sources listed here for more information.